Good afternoon and welcome to today's webinar hosted by the Institute for Women's Policy Research. Thank you for all joining us. I hope everyone's having a good afternoon and getting logged in okay. If you have trouble, please let us know and we'll be able to get you your tech problems sorted shortly. So today we're planning on having a great discussion with some wonderful experts from across the country on how to address abuse affecting survivors who are enrolled in job training programs. My name is Sarah Gonzalez-Bosinski and I will be moderating today's discussion. But before we get started, I just wanted to share a few housekeeping notes so we can make sure we're all on the same page on how to use ReadyTalk and the functions that we have available to us. For audio, for those of you who have not gotten on yet, who probably can't hear me, but please use the chat function in the lower left-hand corner for instructions on how to call in. All of you have been muted at this point so we can make sure we have a clear connection for our speakers today. We will have time at the end of the webinar for questions. If you have a question during the presentation, please do feel free to submit it through the meeting chat. You can either send it to myself, the chairperson, or Mallory Dusenberry, who is another presenter, and we can ask those questions at the end of today's presentation. We will be sending out a recording in the PowerPoint to those who registered for the event. If you find you need a certificate of attendance, you can email us. Our contact information will be found at the end of the presentation as well. And again, if you have any technical issues, you can use the chat box and direct your questions to Mallory Dusenberry, or you can call ReadyTalk at 1-800-843-9166 for support. As I mentioned before, I am Sarah Gonzalez-Bosinski, the Director of the Economic Security for Survivors Project at the Institute for Women's Policy Research. IWPR works with policymakers, scholars, public interest groups to design, execute, and disseminate research that helps to illuminate economic and social policy issues affecting women and families. IWPR conducts research in 5 different program areas. They include employment, education, and economic change, democracy and society, poverty, welfare, and income security, work and family, and health and safety. And for more information about the work IWPR does and its many initiatives, feel free to go to our website, www.iwpr.org. So today's webinar is hosted by 2 of IWPR's initiatives, the Job Training Success Project and the Economic Security for Survivors Project. The Job Training Success Project explores the provision of support services in job training programs that can help participants address the life challenges they face that make it very difficult for them to complete their education and training. These support services can include assistance with child care, transportation, health care, and other important needs along the way. Again, more information about the job training program can be seen by following that link included on the slide. The Economic Security for Survivors Project is an Office on Violence Against Women-funded national technical assistance and training project that focuses on elevating and institutionalizing best practices that help to build, protect, and restore survivor economic security so that they may be safe from abuse and violence in the future. And once again, please feel free to check out the link included on the slide for any of our recent reports. Okay, as I mentioned, we are joined by some fantastic speakers. I will introduce them now, but they will be speaking a little bit later in the presentation. Janice Urbanek is the Executive Director of Partners for a Competitive Workforce, a strategic initiative of the United Way of Greater Cincinnati. Her focus is developing talent supply chains to meet the demand for skilled workers in targeted industry sectors. She serves on boards or leadership councils for this National Skills Coalition, Women's Fund of the Greater Cincinnati Foundation, Jostin Construction, the National Network of Sector Partners, and the Spirit of Construction Federation, and is also heavily involved in efforts to increase the number of women in non-traditional careers. Janice and her work teams have been recognized nationally for their work in assisting underrepresented populations to attain and retain employment in growing industry sectors in the region. Thank you, Janice, for joining us. You know, there's a mouthful of all the different kind of places you're serving. You have a wealth of experience, and we look forward to hearing from you soon. We're also joined by Erica Yingling, who is the Director of Family and Community Intervention at the YWCA Greater Cincinnati. Erica supervises several programs that address underserved and underrepresented groups affected by domestic violence, sexual assault, dating violence, and stalking. These include the CARE Project, Project CARE, which serves individuals with disability who have experienced violence, a co-located domestic violence team at Hamilton County Job and Family Services, which responds to all child welfare cases involving domestic violence, the Rural Intervention and Prevention Teams, which reaches out to rural communities in Brown and Adams counties in Ohio, and the Alliance for Immigrant Women. In addition, Erica chairs Hamilton County's Children Exposed to Violence Work Group, the Family Violence Prevention Project, and LGBTQ Task Force of Hamilton County. Erica, we want to thank you for joining us as well and look forward to hearing about the great work you're doing. And last but not least, we have Wanda Winkler, who is the Executive Vice President of Brighton Center, Inc., which is a nonprofit community-based agency providing uniquely comprehensive range of programs and services to achieve its mission of self-sufficiency. Wanda has a bachelor's from Thomas More College and an MBA from Northern Kentucky University. She has close to 25 years of nonprofit experience. She's actively involved in the community, helping to shape and influence policy and systemic change, and currently serves on the Northern Kentucky Workforce Investment Board, Northern Kentucky Chamber of Commerce Board of Directors, and Women's Initiative Steering Committee, Partners for a Competitive Workforce, Advanced Manufacturing Workforce Development Council, and the United Way Public Policy Council. Thanks again, Wanda, for you joining us. As you can see, we've got a great, diverse panel with a lot of fantastic experience in serving not only survivors of domestic violence, but providing job training services and other workforce development needs. So we'd like to take a moment to get to know who is joining us today. You will see there's a poll now up on your screens. Please indicate what occupation that closely matches what you do for a living. We'll give you a couple minutes to do that. Okay. Right now it looks like we have a lot of advocates from domestic and sexual violence programs. That's great. The next largest group we have is job training programs, some workforce development, government agency staff, community services, research educators. Great, wonderful. And for those of you who are selecting other, if you could let us know in the chat box what you do for a living, that'd be great. Thank you all. Great. So I apologize to the many of you who are experts in domestic violence and sexual assault, but we do want to take a little moment to provide some background on what we're talking about for those who may not be as familiar with violence against women issues. So according to the Prevalence and Characteristics of Sexual Violence, Stalking, and Intimate Partner Violence Victimization National Intimate Partner and Sexual Violence Survey, conducted in 2010, we know that 1 in 4 women and 1 in 10 men have experienced some form of violence in their lifetime. And of course, domestic violence affects women and men of all backgrounds, ranges of socioeconomic, wealthy, those who are low income, racial and ethnic groups, all ages, education level, whether you live in a city or in a rural location, domestic violence affects everyone. There's no one person to look for. So whether you are a domestic violence, sexual violence program, or workforce development provider, you are very likely serving survivors in your program every day. So understanding the dynamics of abuse, assessing the needs of survivors, providing adequate supports is necessary to help them break free from abuse and succeed in the future. Again, for those of you working to end domestic and sexual violence, I know you're very familiar with the power and control wheel, but for those of you who may not be, the Power and Control Wheel was developed by the Domestic Abuse Intervention Project. It shows the many forms that violence and abuse takes. Of course, violence is not limited to physical and sexual assaults. Abusive behavior includes emotional abuse, coercion and threats, intimidation, isolation, victim blaming, using children as pawns, exercising male privileges, and of course, economic abuse. I know that the wheel is pretty small on our screen here, but if you go Google search the Duluth model, you'll be able to find a larger version pretty easily. Now, often these behaviors may be less obvious, but they have serious effects on survivors. Abusers who are able to control their partners in every aspect of their life, ultimately leaving them with few options to break free from the cycle of abuse. And many of the tactics used by abusers to exert power and control have severe short and long-term impacts, particularly economic impacts, on survivors. Abuse can impose significant expenses on survivors, including physical and mental health care costs, lost wages, safety planning, and relocation costs. Furthermore, economic abuse can result in lifelong consequences due to job loss or poor work history, crippling debt, damaged credit, or having been coerced into crime that has left the survivor with a criminal history, ultimately leaving the survivor economically insecure. Now, and numerous studies have found that these economic factors have a significant impact on the ability of survivors to leave and maintain independence from their abusers, especially when you consider today's high cost of living, the shortage of quality jobs, and diminished safety net. These impacts can severely limit survivors' options and their abilities to achieve future independence and security. So helping survivors build economic security is one of our big priorities with the Economic Security for Survivors project, and overlaps nicely with the job training project work. So that's why we're taking a moment today to look at some of these intersections. And we know that job training programs are a valuable resource for survivors seeking to build skills and attain careers that can hopefully provide a wage in which they can support themselves and their families in the future. So to determine how we best help survivors overcome the economic consequences of abuse, we need to first understand them a little bit better. Here you can see the three different categories we often see economic abuse falling into. Economic abuse occurs when an abuser attempts or makes an individual financially dependent by controlling finances, withholding one's access to money, forbidding attendance at school or holding a job or job training programs. And as you can see, they're all spread out across these three categories. We have economic sabotage, which is all about preventing survivors from acquiring resources that will help them be economically secure. Economic control, which either prevents them from getting resources or prevents them from using resources available to them. And economic exploitation, which we often see identity theft in this category, destruction of property, and damaging credit. So some abusers prohibit survivors from working. They interfere in their jobs, manipulate vital resources such as childcare or transportation, or they may increase abuse in response to survivors' employment, leaving them at risk for periods of unemployment, job loss, and financial insecurity across the lifespan. Abusers can take credit cards and create debt, destroy property, purposefully ruin credit scores so that the survivor is saddled with debt and has few opportunities to actually get safe housing or the loans they need to rebuild their lives. And some, as I had mentioned, have direct control over survivors' finances. All of these are very deliberate actions meant to limit partners' options and increase their dependence on the abuser to meet her or his basic needs. Unfortunately, there's very limited research on the prevalence of economic abuse, but what we do know from one study of survivors at 15 different domestic violence programs that offered financial literacy curriculum, many of you may know this, the all-state curriculum, looking at this. Of the 120 survivors who participated in the survey, they found that 94% had reported experiencing economic abuse within the last 12 months. Of these three types, economic control was the most prevalent at 92%, followed by economic sabotage at 88%, and exploitation at 79%. And we see economic sabotage in many different forms. A survey of education and training program participants in a suburban New Jersey county found that among those who reported experiencing domestic violence, 47% said their partners were not supportive of their educational pursuits, and 40% had partners said they were actively trying to prevent them from participating in the job training programs or in education. When asked specifically how the partner responded, you can see some of the responses here. Nearly half of them expressed jealousy. A third of the abusers said that they told the partner they would fail, and 20% had harassed or threatened them. While it may be surprising, women who were told that working women are bad mothers, these women were 5 times more likely to drop out of the program than those who were either threatened, harassed, were told that the partner was jealous, or told that they would fail. Women who were told that they also needed to maintain the household, keep up with their housework and chores, These women were 3 times more likely to drop out of the program. And just another look at some of the common tactics that abusers use to interfere. While this study focuses on employed survivors, not those directly in training programs, these tactics are likely to be seen to sabotage the efforts of survivors who are seeking to increase their skills and employment prospects. So as you can see, being repeatedly called at work is an incredibly common response. The report showed that some survivors said anywhere between 100 and 250 calls a week. Starting a fight before work, repeatedly showing up, keeping the survivor up late at night so he or she is unable to perform to their best abilities the next day, being assaulted before work, as we mentioned before, refusing to take care of child care or taking the car away, are other very common tactics. And as a result of these behaviors, 98% of survivors had reported difficulty concentrating on work, 96% reported that they had difficulty performing their job duties, and 60% of survivors in this survey reported that they had been fired or were asked to resign as a result of these tactics by their abuser. And recently, this spring, IWPR conducted a nationwide online survey of job training program administrators. This survey was of 188 organizations. They provided occupational skills training, including 86 community college, 67 community-based training organizations, 31 vocational, technical, and apprenticeship schools, and 4 other organizations. We have some of the findings here from what we learned. 83% of respondents had reported that their program participants were receiving some domestic violence services. Many of those surveyed said that they helped their job training program participants access domestic violence services. 15% provide those services directly, and 85% refer them to other organizations. So obviously this is not a fully met need, and one that we need to make sure that we're looking at in the future in order to best serve survivors. I also included the full list of the greatest unmet needs for women. For those of you who are domestic violence advocates and work with survivors, this list is probably going to look incredibly familiar to you as what the big needs you see with survivors coming into your programs. Getting help with housing assistance, child care, actual financial cash relief, all of these are really big needs and challenges facing survivors. So thinking about how we can help them in building economic security, being able to successfully complete one's job training program is critical to help them move forward and address all of these issues. And at the same time, those programs need to be able to support survivors trying to address these challenges. When survivors have improved opportunities, they'll be able to be more resilient in the future. And as our project often says, economic security equals safety. So we believe this is incredibly valuable. And here's, sorry, I went too far ahead. Here you can see from some of the administrators themselves what the impact has been. Respondents who have helped their participants access domestic violence services said it can make a critical difference. These are just 2 examples of some feedback we received through the survey. As you can see, being able to recognize the red flags of abuse and offering support in a way that promotes survivor autonomy and safety really made a big impact on these 2 women and helped them complete their training, and hopefully they will go on to be free of abuse in the future and achieve some level of economic security. So I don't want to take up any more of your time. I really would love to turn it over to our speakers who can share more about their findings in response to this critical need. So first, I'm going to turn it over to Janice. Janice, can you hear me?
I can. Can everybody hear me?
We can hear you loud and clear.
All right, great, thanks.
Thank you, Janice.
Thank you. So as she said, I'm the Executive Director of Partners for a Competitive Workforce. We are a strategic initiative of the United Way of Greater Cincinnati. We are what's called a workforce intermediary, meaning that we are a convener, a facilitator, a dot connector, some days a cat herder, where we work in 5 targeted industry sectors, understand from employers what their workforce needs are by occupation, skills and competencies, and then we work to align the public and private resources, the training from community colleges, community-based organizations, career tech centers, et cetera, to make sure that they're preparing people with those needs. it's through this work that for a number of years, and even before partners existed, there had been a number of efforts to get women into the workforce, particularly in non-traditional careers in construction and manufacturing and others. And we continued to really not be able to move the needle. And we started to see instances of, what we called self-sabotage, meaning that women would enroll in the training or they wouldn't complete, or they would complete the training and we would get them lined up with an interview or even a job offer, and then they would turn down the interview or not show up for the job offer. And we couldn't find out what was going on. And we got odd responses from the women, things like, well, I talked it over with my boyfriend or my husband and we decided this wasn't the right fit. And we couldn't quite put it all together. So about a year ago, I was talking to a workforce training program in Chicago, and they mentioned, and this was for construction, that they see a big uptick in domestic violence the weekend before an apprenticeship program was to start for the women. And I was shocked by that. And so I started to do an informal poll of the training providers in the Greater Cincinnati region, and they all said, yes, we see it every day, but we only have anecdotal data. We don't have any quantitative data. So I said, well, we got to figure this out. I think this is a big issue, but we can't quantify it, and we can't drive action unless we can really quantify it. So we started a pilot program that was basically a quick snapshot for us to dimension what is that incidence rate. And the line that we drew was these were for people, and it was men and women who were pursuing workforce training, be it their GED or getting into an industry-recognized credential training or something like that. And we worked with the 5 agencies that are shown there on the second bullet point. 4 of them are financial opportunity centers. For those of you who are familiar with the FOC model, we selected them in particular because of their deep relationships that they form with the clients that they work with. And then the 5th agency was the YWCA, and it's because of their mission to eliminate domestic violence. And so we got them involved to help provide training, and Erica will be talking about that in a minute. So out of this pilot study that we did, and we'll get into the details of how we ran the study, these 5 agencies screened 328 people, and on average, 30% of those who were screened reported some history of intimidation or intimate partner violence. Now, there was a pretty big range between the agencies and even within certain programs within a given agency, and so you can see the range there of upwards of 43% of the people who were trying to enroll in a training workforce program reported some history. The key thing here is that all agencies believe that these numbers are actually low because this was a self-report. We actually believe that the real numbers are much higher than that. When we did a demographic analysis, 81% of the people who had reported this experience were female, 19% were male. We did break it out by race and ethnicity, and what we saw was that, again, for this study, which was a quick snapshot, that people of color reported at a rate, reported an incident rate somewhat lower than how they were represented in the study. But the important thing, and I'll explain this in a minute, of the people who reported a history with intimidation or intimate partner violence, there were 177 kids in the homes. So that 30%, which worked out to be about 98 people, 98 of the people who were reporting this history who were in workforce training had 177 children in their homes. And there is research that talks about the generational impact of witnessing domestic violence. So the implications from these results are, since we're a workforce intermediary, you hear things all the time about the skills gap, the skills gap, the skills gap. We just need to get people skilled up so that they can go take these jobs. Well, we all know, because we saw that other screen that had all of the other barriers, that it's not only a skills gap, that there is the transportation issue, the child care issue, et cetera, et cetera. We're trying to talk about domestic violence as big of a barrier to people getting into the workforce or advancing in their careers, just as big as the skills gap, and thus we need to treat it accordingly. And so the reason the the number of children in the household is important is because in our region, and particularly in the city of Cincinnati, we have started a major child poverty collaborative which has a goal of in 5 years lifting 10,000 kids and 5,000 families out of poverty. Well, we know from data in our region that 66% of the kids who are in poverty are in single female households. So if the very folks we're trying to help raise out of poverty are experiencing intimidation or intimate partner violence, we have got to deal with this because we are not going to be able to move them out of poverty unless we deal with the domestic violence issue. So the next steps that we're taking at a very high level are we're in the process of setting up a number of sessions where we're going to be working with other agencies and with the population at large to raise awareness of the issue because it seems in our community to be a problem that is hiding in plain sight in that all of the agencies know that it's an issue, but we're not talking about it. And so it is truly hiding, but it is in plain sight. So what we want to do is try to get more agencies over and above the 5 that were a part of this pilot study to start screening so that we can get more data. We're also in the process of working with a funder to raise funds for a much more technically rigorous and more formal study so that we can get stronger data and to look at many more factors than what we were able to in this quick study. But then also thinking about this at a cultural level and thinking about it from a prevention standpoint, we're really starting to think about how can our region react to this at that cultural level. So next is my contact information if you have any other questions. But I think we have a poll next, and then Erica is going to talk about how we set up the agencies to do the screening.
Thanks so much, Janice. And I really want to underscore what you said, that domestic violence is a barrier just as large as a skill gap. And I think a lot of the advocates we work with definitely agree with that, and we're so glad to hear that you as a workforce intermediary see that as well. And I'm sure later on during the questions we might talk a little bit about how domestic violence agencies and sexual assault agencies can partner with workforce collaboratives to make sure that we're best serving the needs of survivors. So thank you again for all that valuable information. So I'm going to turn it over to the poll. For those of you who are job training program staff or who do workforce development, what share of your participants are experiencing or have experienced some form of intimate partner violence? You can take a few minutes to respond. Yep, not surprising to many of us. I'm seeing right now, just under 50%, say 76 to 100% of survivors of participants are survivors of violence. Go ahead and give you all another minute to complete the poll. And then we have around a little over 25% who think it's 0 to 25% of participants. Okay, thanks for participating. So I think you can all see that on your screen now. So again, we're seeing a lot of programs are believing that a large majority of participants are survivors of violence. We're seeing also a number think that it's maybe 0 to 25%. So I'm going to turn it over to Erica, who can talk a little bit more about screening.
Hi, thanks everybody for being here today. I just want to talk a little bit about some of the basic training protocols that we put in place and some of the screening practices. Now, one of the unique things about the YWCA Greater Cincinnati is we are primarily a domestic violence sexual assault agency. However, we also have workforce development staff on site to help some of our clients and some clients that aren't affected by our victim service programs be able to engage in services that allow educational and economic opportunity. My slides aren't working. Hold on. There we go. Okay, there we go. So that makes us unique because this was something we noticed from a victim service perspective happening. We would have people be waiting outside in their cars for some of our clients in workforce development. There were certain situations that occurred when partners would take classes together that made us really question, one, how many of our clients are being affected by domestic violence and how this prohibited them from educational and economic success. So part of this pilot work that we've done in conjunction with other agencies that primarily provide workforce development is give basic training to all of workforce development staff who will administer an intake for their clients that enter through the door. And that training really needs to happen from our perspective, I guess the DV perspective, and some of you, I'm sure, in this webinar, you know, the fundamentals and the foundations of domestic violence are something that we work with every day. But workforce development people may not have that knowledge and that base. So we really worked on a training package that just introduced what domestic violence is, what it looks like, what intimate partner violence is, what are the legal definitions, what are some of the processes or steps that we can take to help somebody when they disclose, and just the basic rudimentary facts about the power and control wheel. One of the things that's really important in this piece is just the introduction to what the patterns of coercive control look like, so that they're able as an intake staff to identify them if they see them within, you know, their classroom walls or their office walls. So some of the other things that we really honed in on were the predicament of individuals that are in abusive relationships. The facts like it takes somebody 7 to 8 times to really leave and fully exit a relationship, and how to use language that's supportive and not victim blaming. You know, for example, not saying, well, why are you still in that relationship? You know, instead saying, what can I do to help you? And then also to try to provide and connect the dots on information and resources and services that that specific community offers. You know, as I said, we're in a unique position because we have victim service advocates on site. But for those who don't, it's about having the ability to call, to do a warm referral to somebody like us, to be able to go in there and provide maybe safety planning or lethality risk assessment to that person when they disclose. So some of what we started with after those rudimentary DV 101, what I like to call, are ground rules for screening. I think those of us who work in victim service agencies and advocacy centers know that a screen is not always going to get the amount of disclosures maybe that it should. So one of the things that we really focus on is how to do it most effectively. And we know a verbal screen is the most effective kind. So rather than handing you know, a piece of paper to somebody asking a question, our intake specialist is going to administer this screen verbally with that client one-on-one. And then some of the things that we try to really focus on are the acknowledgement of strengths in that person if there's a disclosure, the validation of the experience and understanding, the affirmation that there could be potential harm in an unsafe relationship, the affirmation of positive messages, and of course viable options and resources available. We also try to not be the one who says that everything's going to be okay, because sometimes we can't make those predictions, and it gives a false sense of security and safety to that client that we're trying to serve. I think when Janice was talking, what was really interesting to me is the range of disclosures that we received between the agencies. So we have 3% to 43%. And a lot of that's contingent upon whether or not the screen is done at the initial intake, whether it's done 1 or 2 weeks later into the program, whether you're screening a woman and the screener is also female, or if that screener is male. All of those things are going to change that disclosure rate. So some of the direct screening questions that we use are, have you been afraid of your partner or ex-partner? Have you been emotionally or physically abused by somebody that's important to you? Have you ever been hit, slapped, or kicked, otherwise controlled by your partner or someone important to you? I mean, and these are very direct. And sometimes it's not appropriate if we're doing a screen intake at day 1 to ask these kinds of questions, because we might not get that disclosure. So then we move to an indirect screening questions. And that's, do you have anyone in your life who is unhappy or upset about your return to school or work? Are you afraid or concerned that somebody blank will prevent you from attending this program? And do you have any concerns about your safety? These seem more appropriate in this type of work with clients that are coming in for a service not related to domestic violence or sexual assault, rather for economic or educational opportunity. So based on these best practices of indirect and direct screening questions, we came up, and this is the actual one that we use here at the YWCA, our workplace barrier screening. And it asks, do you have someone in your life who's unhappy or upset about your return? So that's indirect. Are you afraid? Indirect. Do you have concerns for your safety? And if there is a disclosure, is there anything that you would like us to do about this? And we have to remember, as talked about in part of our basic training protocol, we have to let the survivor steer the ship when it comes to safety planning, when it comes to disclosure, when it comes to next steps in their relationship or what they choose to do. So some of the protocol that we came up in regards to the post-screen process, we say when there's not a disclosure, we close the screening by saying something affirming. Moving forward, please let me know if you have any concerns for your safety. I'm able to provide you with important information and referrals. When there is a disclosure but that participant does not want services, we can say, if anything changes and you want help or support, please don't hesitate to reach out to me. I can provide you safety planning information and referrals for advocacy. And then, if there is a disclosure and that participant wants services, we need to ask, do you feel safe returning to your home? And whatever the answer is, make sure that it's an affirming message that you can assist or provide that client with community referrals and numbers that can help in safety planning options. So it's important that we all work together to share information about what those local resources in our community are that provide domestic violence shelter, advocacy, court accompaniment, and of course, something very important to me is the lethality and risk assessment. So that's just a little bit of how we're trying to make the connections between some of our programs and our community providers, because we know as a domestic violence shelter provider in Hamilton County in Ohio that 93% of all of our clients entering shelter report that they have been economically isolated, financially abused. And this remains a big deterrent for them gaining their own independence in order to leave that relationship and work on safety in the future. So I think that's all I have. And here's some information how to contact me if you're interested in the work that we're doing or some of the training package that we offer.
Great. Thank you so much, Erica. Yeah, what you said is incredibly important in terms of the screening process and having those referrals at the ready, which conveniently leads me into the next polling questions that we have. So first up, for workforce development providers, are you currently partnering with domestic violence programs to help make sure you're meeting the needs of survivors who might be participants? So I'll take a few minutes. Give everyone another minute. Great. I'm glad to see that so many of you are. For those of you who may not be, you might be able to get connected today with other great resources. For example, the YWCA network might be able to help, and others. Okay, great. I'm going to close that poll. And on the other end, for those of you who are domestic violence providers, are you currently partnering with any workforce development agencies or service providers to help support survivors in job training programs? Give everyone just another minute, a couple seconds. And again, the overwhelming majority of you do. Could be another opportunity for those of you. I know that everyone's very overcommitted as usual, but it might be something that could not only help improve the programs being provided by job training providers, but also could help survivors get that important link to job training and career enhancement so they can have more economically secure jobs in the future. Great, so I'm going to close that poll. And Now I wanted to turn this over to our last speaker, Wanda Winkler, who can give you a little more information about the work that they've done at the Brighton Center. So, Wanda?
Great, thanks. Great, thank you. I've been at Brighton Center. This is my 23rd year at Brighton Center this year, and I started in workforce development. And it was interesting to see as we were particularly doing short-term skill training and evolving to a program model called Center for Employment Training back in the 90s. One of the things that I was really taken back as a new professional into the field was the amount of self-disclosure when it came to the economic sabotage that was happening with folks. And over the last 20 plus years, had seen it as an issue, of course, as we're working with individuals and families to create opportunities for self-sufficiency, and how that was a significant barrier or obstacle to folks as they were moving forward on their journey. And so when Janice approached me about being a part of this domestic violence pilot, it was something that we were very happy and eager to do, because really having an informed dialogue and data to be able to speak to how pronounced this issue is for folks, was something that we were really eager to have that kind of information to really inform the work. So for us as an organization, we are a private, nonprofit, community-based organization, but we're uniquely comprehensive in our scope of work. We do a lot of work with folks around family and work supports. We do a lot around financial and home ownership services. In the area of workforce development, we do education, employment, and training programming. We have substance abuse recovery services for women. We play a lot in the space with early childhood education, whether it's home visitation, a network of family daycare homes, or quality center-based care that we have. But we also have a neighborhood-based perspective in all that we do, from community organizing to affordable housing development. But working with families to become financially stable and to be economically self-sufficient, of course, workforce development has been a part of our organization for the last 40 of our 50 years. And so, for us, we do have a broad footprint. We're right across from our friends in Hamilton County in northern Kentucky. We do serve the 8 counties of northern Kentucky, which is a mixture of urban, suburban, and rural. And we do serve in providing financial opportunity center philosophy in our approach to work. And for us, though, when we were looking at the pilot, we had to decide which programs were we going to do the screenings in. And so we chose 3 programs that we would focus more specifically in. The first one is Brighton Center for Employment Training. And that's a nationally recognized and accredited skill-specific training program. It's very comprehensive, individually and competency-based kind of program. We have 2 skill divisions that we train in right now. One is medical assisting and the other is business and computer technologies. We also wanted to talk to folks that were in our Career Connections program. And in northern Kentucky, the Workforce Innovation and Opportunity Act dollars come to the state of Kentucky and then are distributed across the state through area development districts. Our 8-county area development district contracts for the provision of those services, so Brighton Center is the contracted provider. We do focus on 5 demand industry clusters. We work with advanced manufacturing, installation, maintenance, and repair, health, transportation and logistics, and IT, business, and finance. And so we partner with 8 other organizations in our Kentucky Career Center, but we wanted to focus in on particularly those folks that were engaged in more intensive and training-related services. And then lastly was Northern Kentucky Scholar House. This is a newer project for us within the last year being up and running. We have 48 units. It's for single parents, and it just so happens right now they are all single moms with children. They have to be enrolled in a 2-year or 4-year degree to live there residentially, and then we also have a quality early child care facility on site called Early Scholars, where the children are also working on their age-appropriate development. So we really have a 2-gen approach there. So those were the programs that we started with as far as reaching out and doing the screenings once we were trained by the Y. What we did specifically is we spoke with 117 individuals, and for us, collectively, in all the data that was assembled, we had 46 of our 117 that we spoke with, or 39%, that reported domestic violence. And you can see by program how that ranged. We went from 29% in our Career Connections program, which is our Workforce Innovation and Opportunity Act services, all the way to 62% within our Northern Kentucky Scholar House program. For us, it was really interesting, because we've been providing holistic wraparound services to folks for a really long time, and we spent a lot of time training and speaking with staff about barriers that stop people on their journey to self-sufficiency. But it was really interesting to be able to focus in on workforce development and to be able to share the training specifically with staff and some newer staff, some staff that had been here for a while. But in the state of Kentucky, we are a mandatory reporter, and our local domestic violence organization on this side of the river is Women's Crisis Center. And so, we spent some time doing the training with staff. It was an issue that would show up, obviously, in the discussion of barriers and barrier removal, but we hadn't done specific targeted screening questions like the direct or indirect questions that Erica spoke to. And so for us, we, after doing the training in those 3 programs, we were able to initiate gathering the data. But it was interesting to see a little bit of the reluctance. As a community-based organization, we're not clinically driven as an organization per se, and so there was a little bit of staff reluctance, to be able to ask the very specific targeted screening questions, because there was just some reluctance that would open up and force them to engage in a conversation that they felt that they weren't equipped to be able to handle. And so through the training and the dialogue and the discussion, I think we got to a good place, but I guess I was initially just, as an administrator, just uncertain as to the level of the reluctance that staff had. It did force a dialogue with us to really partner in different kinds, more meaningful ways with Women's Crisis Center. They have been coming on site in our workforce development programs, particularly at Northern Kentucky Scholar House. We're looking at specifically partnering with them in the near future so that we have a MSW student who will be supervised by Women's Crisis that will be on site in our facility, so that if there's an issue or concern about mandatory reporting, then they can work directly with our partner, Women's Crisis Center. We're also spent some time looking at the human development or life skills training components that we offered on site in our workforce development programs, and strengthening and building in more of a deep and meaningful way the kinds of education and support that we can provide, and then of course connecting folks in a more deep and meaningful way to the kind of support and counseling that they would need. Some of that we're hoping to be able to provide on-site moving forward in partnership with Women's Crisis, but at least initially being able to connect better and making those referrals. So for us as an organization moving forward, because of our scope of work, we have 7 different departments. These 3 programs fall under 2 of the departments, but we have 5 other departments that we need to really engage in meaningful discussion and dialogue about specific screening questions, how we continue to capture the data, how as an organization we use that data and even look at it through an equity lens, to continue to more formally broaden deeper partnerships with Women's Crisis Center, and to be able to look at not only that within our workforce programs, but across our organization. Of course, we are very interested in continuing this dialogue regionally. We want to be able to contribute if we are able to proceed with more of a formal study. I think we very much would have an interest in doing that, because we're very excited about the opportunities that it can pose for us to inform the work moving forward. So here is my contact information. I'm happy to share any more specifics about how we were able to take the screening boots on the ground in a community-based organization here in our region.
Great. Thank you so much, Wanda. That was very helpful. So now it looks like we have 10 minutes remaining, which is great. So we have a couple of questions that have come in already through the chat, but if you have additional questions for our speakers today, please feel free to go ahead and type them out. You can submit them either to Mallory Dusenberry or myself, the chairperson, and we'll go ahead and ask them of the speakers. So I'm going to look to the first couple of ones we have. Janice, the first one's directed towards you. Was the incidence of domestic violence particularly high for women pursuing training in a non-traditional field, or was it similar for all women who pursued training regardless of the field?
I think based upon the data that Wanda shared and the programs that Brighton Center was screening individuals for, as well as one of the other agencies that had a higher rate of positive responses, that was general work readiness preparation, I would say that it was not necessarily focused on the non-traditional occupations. It was general work readiness, or it was in programs that tended to be something that would be more female-dominated. Wanda, would you agree with that?
I would overall agree with that. Probably the only place that we were able to hit that a little bit more harder was through Career Connections because of our work with advanced manufacturing and our advanced manufacturing workforce development coalition that we're a partner in. So there were some folks in that subset that were a part of it, but we've not cross-cutted the data that way to be able to pull it out. So I would agree that it's probably more generalized at this point.
Great, thanks. And just a couple other questions. This pilot was only in Ohio and Kentucky, correct? And the question is also asking, are there plans to expand to other states?
It was not all of Ohio and all of Kentucky. Where Cincinnati is like right in the corner of a tri-state region, which is southwest Ohio, northern Kentucky, and southeast Indiana. And the agencies that were represented in this were predominantly within southwest Ohio, within Cincinnati and the county there, and then Brighton Center, as Wanda discussed, in the counties in northern Kentucky. So it was just a portion of those two states. As we think about getting into the larger study that we referenced, it would still be within that region, but it would be across more agencies, but then also perhaps including the community colleges and the universities and the career tech schools. Because I know from informal discussions I've had with all of them, they have all seen it and they would like to be involved. So it would be increasing community-based organizations, but then also the higher eds.
Mm-hmm. Great. And someone was asking a question if the programs used the same screening questions. Do they all use something similar, or do they use different ones based on site?
I believe they used all the same. That's why we did the training all together so that everybody got the same information. Now, I got to believe there might have been some variation between. And Wanda, do you want to talk about, was there any variation within your three programs?
Sure. No, actually for all three of the programs that we administered the screens through, we did the indirect screening questions that Erica had spoke to. I think most of the partner agencies use the indirect. I'm trying to recall from our discussions along the way, I think most folks were at least inclined to start there versus the direct screening questions that Erica shared in the previous slide.
Okay, thanks. And I'm not sure who might be the best person to ask this question or answer the question. Do programs already train participants about general know your rights around workers' rights that are guaranteed in law? And are any domestic violence related protections that exist in Ohio or Kentucky law incorporated into trainings for participants?
I can answer the second part. This is Erica from the YWCA. No, we aren't. There are laws specific to protecting survivors in employment around domestic violence. However, in our training, we haven't gotten that far yet, but I think after talking to some of our partner agencies and our next step in our own workforce development team here, we are going to get more extensive training, because what we started with was very rudimentary. In Ohio, we have Safe Harbor, which prevents survivors from being fired, which allows them to take time off work, and it's an initiative right now that I believe is in our House or Senate, and it looks like it's going to be passed, but also the federal VAWA provisions that protect survivors around employment and not losing their jobs if an incident of domestic violence occurs or they're being harassed or stalked on site at either their job or a workforce readiness program. So I think that would be a next step, is to get more into the complexities around the protections that we have, so we can move forward and really enhance the program and our pilot. I don't know if you guys wanted to chime in anything else about that from the workforce perspective.
I would just add that probably across all the partner agencies, there's going to be variations on the training around workers' rights and knowing your rights. There's some degree of generalization that we provide specifically in the context of what we call success skills or human development or life skills trainings from that perspective. The only thing that we had to be particularly careful about in Kentucky when it came to Kentucky statute was being a mandatory reporter and then being able to work with our local domestic violence organization, obviously because of their status and not having the same issue or concern in working with folks as they self-disclose.
Okay, thanks. I'm sorry, I'm just scrolling through all the questions that we're getting right now, trying to make sure we could get to everyone. Where are the majority of study participants? Were the majority, of the study participants low income, and how does socioeconomic status change the agency response to domestic violence? It's a big question.
The agencies who participated in this do serve primarily individuals with low incomes. So yes, in effect, the report that we mentioned, the report that we issued after this study, I made a comment about that, but also recognizing that this issue transcends socioeconomic status, that it affects every form of that. Erica or Wanda, do you have any perspective around how the response might change based on economic status?
I would venture to say, just looking specifically, for us, I would say 100% of the folks were at least 200% of poverty or below. As far as our screen, and there were slight variations to that based upon program. Northern Kentucky Scholar House is going to be 50% of area median income and below because of the qualifications for that program, but we have a little bit different flexibility within the Career Center. I would speculate to say, that even though we're primarily focusing on low income, if we had a broader socioeconomic population, that we would see the same kind of outcome.
And that is very true, Wanda. It certainly in workforce development, the clients that we serve are low-income clients, but across all the multiple programs here at the YWCA, that's not inclusive to our client base, and we find that disclosure rates remain pretty consistent, disregarding economic status, as we know domestic violence impacts or can potentially impact anybody.
Okay, thanks. I think we might have time for one more question. I'll see if I could capture this one neatly, so sorry if I fail to do that. Participants talking about a job training program that they have, and they do workshops around effective communication in the workplace. She says that they've seen through observation that students who have experienced domestic violence in the past have some difficulty. They either tend to use aggressive or passive communication styles. So the question is, how can we be sensitive to how their history of violence can influence their communication style while emphasizing the importance of having assertive communication or workplace communication? Not sure who might be the best for that. Erica, you might be a good person to start.
Yeah, I could certainly attempt to answer that. And I think part of that goes back to what I was discussing, and even when conducting a screen, what kind of language do we use? And how do we use language that is positive in the affirmations, that's validating? So if somebody has more an aggressive style, trying to redirect and say something like, I do understand why you may feel this way, however, so it's really maintaining that kind of sense of cooperation and open communication between the clients who we're working with, and not to use a cliche phrase, but meeting them where they are, because people do respond differently to a trauma history. And once we know that history, I think as providers, it really allows us to be able to better understand and more effectively work with them.
Okay, thanks. So I think we are actually out of time, and I want to be respectful of everyone's time this afternoon. If there are additional questions, please feel free to reach out to us, and we can connect you with the speakers. We'll be sending, again, the presentation out, so you'll have everyone's contact information. I want to take a minute to just thank you all for joining us, and thank you to our speakers who provided such wonderful information. Hopefully we can continue to work on how job training programs and how domestic violence programs can support one another so that we're best meeting the needs of survivors and helping them become economically secure in the future. We have a little bit of a survey that you'll be sent after you exit the webinar presentation, so I hope you take a moment to fill that out to see if there's additional information we can provide on this webinar and further information we can provide resources on. So again, thank you to Janice, Erica, and Wanda for joining us today and sharing the valuable information you had. And thank you all for joining us who are participants.
Thank you.
Thank you.
Thank you.
Thank you.
Have a wonderful day.